Good afternoon. Welcome to the weekly update here at St. Clair County Emergency Management Agency, where I'm joined with Chairman Mark Kern and, of course, the lady with the numbers, Sam Bierman. Sam, it's been a long week. I know you've been busy, and the health department's been busy, and so why don't you tell our followers the numbers?
All right. So happy to be back again. As you guys have known, the test numbers that we report to you for St. Clair County are for those tests that have been performed in St. Clair County. And as of today, we are at 18,426 that have been tested, with 2,167 positive test results, which is an increase of 34 from yesterday. And those do include both males and females from under the age of 1 up to their 80s. We are at 16,122 negative test results, with 137 results that are still pending. We do have some sad news to announce today, as we are adding one additional death, which brings St. Clair County total to 139. That was a female in her 40s who did have underlying health conditions, and as always, our condolences go out to her family. For those who have completed the required IDPH 14-day quarantine period, we are at 1,578. For state totals, we are at 1,666,317 that have been tested, with 144,882 positive test results, which is an increase of 869 from yesterday. And for deaths, the state is reporting 6,987, which is an increase of 36 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 27 patients that are admitted due to COVID-related reasons, and 2 of those patients are currently on ventilators. For long-term care facilities, I am happy to announce that as of today, we have no new additions. So the congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms. The Atrium of Belleville has 2 cases and no deaths. Brea of Belleville has 52 cases and 6 deaths. Brea of Cahokia has 25 cases and 3 deaths. Caritas Family Solutions has 12 cases and no deaths. Caseyville Nursing and Rehab has 4 cases and no deaths. Cedarhurst of Shiloh has 13 cases and no deaths. Cedar Ridge of Lebanon has 73 cases and 10 deaths. Cedars of Lebanon has 2 cases and no deaths. Colonnade Senior Living in O'Fallon has 5 cases and no deaths. Esquilin, the Dammert Center at the Shrine, has 2 cases and no deaths. Four Fountains in Belleville has 104 cases and 27 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Integrity Healthcare in Belleville has 2 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center has 56 cases and 10 deaths. Memorial Care Center in Belleville has 49 cases and 5 deaths. Mercy Rehab and Care Center in Swansea has 2 cases and no deaths. New Athens Home for the Aged has 57 cases and 7 deaths. St. Paul's Home in Belleville has 50 cases and 14 deaths. Swansea Rehab and Care Center has 30 cases and 6 deaths. And TDL Incorporated in Belleville has 4 cases and no deaths. And we do have an update on some of our testing site locations within St. Clair County. The Cahokia Walgreens that is at 1201 Camp Jackson Road, while you can still go up without an appointment, they are strongly recommending it. Some people that have gone have waited in line for quite a while, and when they get up there, have not been able to have the test performed. So we're recommending that you call before you go. That phone number is 618-332-2904. And the Southern Illinois Healthcare Foundation locations that are static locations, the only one that is still available in St. Clair County is the 7210 West Main Street location in Belleville. And for those of you that did not know, CVS in Swansea at 1801 North Swansea, And at 4609 West Main in Belleville, they are now doing COVID testing, and an appointment is required for both of those locations. So for anyone that would like to go get tested, please feel free to look up any of those locations, as we are still stressing that everyone get tested, even if you don't have symptoms. So now I will turn it over to Chairman Kern.
Thanks, Sam. So the health department continues mobile testing also.
We do, yes.
And it's going well.
It is.
And so that mobile testing is coming to a site near you is basically what we're talking about.
Yes.
I think Lebanon
Lebanon is going to have it
In
next
O'Fallon.
week in O'Fallon.
Lebanon and O'Fallon are
Yes.
next week.
So we've had 3 locations so far and good turnout, so we're hoping to continue that.
And the good turnout is really something to talk about. Almost 3,000 people were tested since we were last together on the 26th of June. Of those 3,000, 246 were positive. So that percentage is, while it's higher than what we'd like, it's still kind of where we need to be to remain where we are in phase 4.
It does, and it points out those people that we need to have isolated in quarantine as to not spread, the virus any further. So that's why we're recommending everyone get tested, even if you don't have symptoms.
And we're seeing that throughout the country. What happens if you don't isolate?
We are.
The hospitalizations go up and it causes real problems. We're seeing the story all over again that we saw in New York, now being played out again in Florida and Arizona.
In Texas, yes. Local businesses that were once open are closing again. So, we just need to take this in stride and do our best to contain it so we can continue moving forward.
So let's not be them.
No, please, please.
Okay, so if you remember, this is the time when we go into the zip code report. As always, if you don't hear your zip code, it doesn't mean that there isn't a COVID positive diagnosis in your zip code. It just means that we're not above the level of 5 yet. In 62059, we remain at 7. 62201 remains at 122. 62203 goes up by 1 today to 70. 62204 remains the same at 69. 62205 goes up by 1 to 84. 62206 goes up by 1 today to 190. 62207 goes up by 1 to 114. 62208 goes up by 1 to 111. 62220 goes up by 4 to 183. 62221 goes up by 2 to 172. 62223 goes up by 1 to 77. 62226 goes up by 3 to 217. 62232 goes up by 1 to 40. 62239 remains the same at 22. 62243 remains the same at 9. 62254 remains the same at 100. 62255 remains the same at 7. And 62257 is also static at 13. 62258 is the same today, also at 21. 62260 goes up by 1 today to 14. 62264 goes down by 1 to 56. As you know, it goes down because perhaps someone moves out of the zip code. There was a wrong zip code reported. In our goal to be as accurate as possible, that's why sometimes we take them down. And 62264 goes down 1 to 56. 62269 goes up by 1 today to 106. And 62285 goes up by 1 to 21. Those are the latest and greatest that we've gotten off the state's website. They just came in a few minutes ago, so they're hot off the press. Today, a guest who's certainly familiar to us all and an old hand on this program is Dana Rosenzweig. Dana is the Executive Director of the St. Clair County Mental Health Board. Dana, welcome back.
Thank you, Mark. Glad to be here.
So, Dana, as we've moved through all the stages of this virus, it's been exceedingly apparent that mental health has been affected through all levels of COVID-19. Here we find ourselves in phase 4. Things have opened up a little bit. Maybe people aren't quite as isolated as they were, but tell us, how are things going mental health-wise in the county?
Okay. Well, yes, I'm glad to have the opportunity, and Even a month or so back, they were talking about the mental health crisis that was going to be unavoidable as a result. And fortunately, we're able to say that in St. Clair County, we've not experienced that. There's not been the giant uptick in the demand for services like we've seen in other parts of the country. And then as a result, we've not been overwhelmed. We've been able to provide the services that have been needed. Initially, experts said that there would be a 20% increase in psychological symptoms as a result of the virus. They were referencing things such as stress, anxiety, depression, and there was concern that that increase in symptoms was just going to be overwhelming for the system. I think in Illinois, with the governor's planful approach to reopening, along with all the resources that were made available, that we've slowed that somewhat, and actually as the numbers have been reflecting positively for medical cases, it's reflected positively for the mental health system as well. Very pleased to report that, Mark. Having said that, I think our readiness has also improved. I've heard you all talk about how systems from schools to medical are all in a position they can respond more effectively should we have another wave. And the mental health system has experienced much the same thing, so we've been pleased to have that opportunity. Glad to report that services such as assessment, counseling, medication monitoring, residential services, all still available. I talked with Chestnut Health System today. You can have a phone screening, get an appointment to be seen within a week. Comprehensive Behavioral Health out of East St. Louis, call for help, fully operational. And what we're also seeing is a transition from all virtual to now in-person services. And that's been good. Some people will need either one. I think it's going to be really helpful that we'll have a blend. So people that still need to be seen through Zoom and through telephone, they have that option. People who need to be seen in person will be providing that. So that's good news. I think the advance with telemedicine through this has been very promising.
And those numbers are out there, and the website is out there. Any main contact that someone can use to get to
Sure.
access those services?
Certainly, the Mental Health Board's website at stc708.org has a listing of all of those resources. If you're in need of publicly funded mental health services, we encourage you to consult that. If you have private insurance, check with your carrier. See who's been approved and who you'd be able to see. We know that private therapists are doing a good business right now. So we also have access to emergency services. If you need acute care, hospitalization, that can be accomplished through coordinating that with outreach in the emergency room. Touche Hospital has bed capacity on the psychiatric floor. That's been very promising, that's sustained. Substance use disorder, you can still get in for inpatient or residential care, and some of that is getting back to pre-COVID levels. One note that I wanted to share, and I know that you had Brent Cummings from Chestnut here, last month, and he talked about the resurgence of substance use during COVID. We've actually seen a significant increase in the number of drug overdose deaths in St. Clair County in the first 5 months of the year. And that was a trend that started even pre-COVID, but we are seeing a lot of drug fatalities from overdose deaths, and that's a concern.
And do you think that was because people are inside and they have just aren't getting out, and so that was maybe their outlet?
Yeah. We're having people that are forced into conditions that they're not accustomed to, and I think that created an additional stressor for people, definitely.
Dana, you talked earlier about Illinois didn't reach some of those metrics that were laid out. It seems that our state's plan laid out phases and said, here's how we're going to get to these phases. It almost gave people something to look forward to. We were coming here saying 2 weeks left.
Yes.
If we wear our masks, if we do all the things that science tells us, we will get to the reward, almost like the next phase was reward status. Do you think that perhaps that played into a certain amount, giving people hope rather than a hopeless feeling, which I think seems to be out there now in some places, because they're seeing this huge surge and they don't quite know how to put the genie back in the bottle.
Exactly. I think for all of us, early on, fear and uncertainty were major drivers of emotions. And now in many places where they've had the resurgence, you have now just emotional fatigue. I mean, you thought you were through it, and now you have to, revisit it again. So I think Illinois' plan was excellent in that it did give people hope. You had some targets and milestones to achieve. The governor reinforced the need for mental health services. He published the Calm for Text line that was utilized. So in Illinois, I think we took the mental health component of this very seriously through the governor's leadership, and I think you're seeing that in some of these numbers now.
With mask wearing, there are certain exceptions. Part of that, one of those is specifically claustrophobia, those type of things. What does a person do? Are there alternatives to a mask, or is it a shield? Or
I usually would defer to the public health experts, but I mean, what we've been seeing, and the reason that we're not pulling people back into group therapy is that you have to maintain social distancing. So for those people who can't wear a mask because of maybe some anxiety or related to claustrophobia, if you're able to maintain that distance, that should be acceptable. But again, I defer to public health. I'm not an expert.
Oh, come on, you're an expert. So you also had a number that was available for our first responders. Was that an effective tool, and was there any usage of that?
It has been. It's the utilization, along with all of the crisis lines. It wasn't as great as anticipated, because I think we were assuming more doom and gloom in the beginning than actually happens. But we have had a response to the first responder and medical line that we also extended to long-term care facilities. I contacted all facilities in the county as well. Sam assisted getting some of that information, and we have served a number of people who have called who, without that resource and that hotline, would have not been able to address some of the issues that they were experiencing. So that number is still in effect. I have to renew it actually next week.
And we will?
Okay, yes, of course. And that number is area code 618-381-5173. And again, that number is designed for medical personnel and first responders who have a need to talk to a disaster mental health professional, and they will be contacted and given an appointment to see someone via phone or Zoom, and that process has worked out extremely well thus far.
So, as always, these services are available at no cost.
Correct.
They're private. Nothing will be divulged to anyone. It's a service that's out there that we encourage everyone to take advantage of, whether you're a first responder or whether you're just having some issues that you think you may want to just talk to someone.
We don't even ask for last names. We need a first name and a number to call you is all we need. So.
Okay.
Along those lines, we'd encourage people, if you're having difficulty functioning, performing normal tasks, interference with relationships, with work, if you have a need to talk with someone, please reach out and do so. There are many resources available, and we want to make sure that people who are in need of care can receive that. I think also the future trickle-down effects. We're not sure what's going to happen, in terms of the psychological component of this, and we want to make sure that we can address those needs.
Dana Rosenzweig, there's nobody better to address those needs than you, and we sure appreciate you being here today. And we're going to bring on someone that Dana brought with him today.
Yes.
You want to talk?
I'll talk. I'll introduce her.
You introduce
Okay.
her, but then it's going to be hard to have you transition and not make it look like...
I'll have you introduce her then.
This is our show.
You're making us look like the Norm Greenberg show.
No. Well, you were off for a week. I understand.
Yeah.
Okay.
Okay, so, we're talking about mental health, and we had first responders, and Dana talked about some issues. Specifically, we're seeing issues with our older adults that may be experiencing the stresses of COVID-19 because we're all worried about them. We've sequestered them, told them to stay home. We'll do your shopping. We'll do all these services for you, but it's kind of a lonely thing being at home. And so today, Tanya Kolker's here. Tanya is she's the leader of the Older Adult and Caregiver Counseling Program with PSOP from SWIC. Tanya, welcome.
Thank you so much for having me. I wouldn't say leader, though.
You are a leader.
I have a colleague, Jody Gardner, who's very well known in the community too, and her and I facilitate the older adult and caregiver counseling program for St. Clair County. It's funded by the 708 board and HSmart as well, so we provide those counseling and resource services to seniors in our community.
Okay, well, let's just say you're a super person.
Oh,
and
well, I'll
we'll
take
leave it
that.
at that. So let's talk a little bit about older adults and the caregiver counseling that you offer. Do you have kind of a general overview?
I made some notes, so I sure do. So our counseling program serves seniors in our community, usually aged 60 and up, and then we also work with caregivers as well. So we've had a lot of experience. A lot of seniors have experienced a lot of different emotions through this time, and our caregivers especially have had a really challenging time. So Jody and I have been meeting their needs on the phone, taking it way back to just using the phone now. Some of our clients utilize Zoom, and I offer that as well. So,
But sometimes technology adds more stress to a situation, and so that the telephone a lot of times may just work the best.
sometimes I have a few clients who have a little have some hearing impairments, so there are still challenges to meeting the needs of our seniors through the phone. Jody and I, our program, our specialty really is meeting people where they are, and that's home visits. Mostly, predominantly, we've met with people in their homes, so we can't do that right now. So we talk very loud on the phone and try to meet the needs as best as we can.
And so these are people that you've had an ongoing relationship. Is there an opportunity for people who've never talked to you before, maybe to get into the program?
Yeah, absolutely. You know, we're part of SWIC's PSOP campus over here in Belleville. So we have a lot of established clients, but we also really encourage seniors in our community that are struggling with an adjustment type of disorder. COVID being a perfect example of how stressful that situation can be. And so we encourage them to reach out. Our services are free. There's no charge for them to utilize two licensed clinicians to talk through what they're going through.
What about if they just want to talk about their daily life? That perhaps they want to talk about a movie they saw, or just reminisce a little bit about the past. Is that a kind ear is waiting on the other end of the phone?
I sincerely appreciate you differentiating between the two things. So our program is a counseling program. So our goal is to help with symptoms of anxiety, depression, any kind of adjustment issues. While I do appreciate hearing about someone's day and find it very valuable, we are not necessarily a service that provides friendly, warm check-ins like that. We do have senior companion services and other volunteer programs through PSOP that can possibly meet those needs as well.
So do you reach out, or are you reached out to?
Sometimes both. We get referrals from the community, different case management agencies that are seeing seniors in the community will reach out to us with a referral they have, and then we reach to them. And we have a lot of adult children who are concerned about their parents and that, and so we do some reaching, but we encourage people to reach to us too.
And what is your reach? How many people are currently are you assisting in your program?
That's hard to say. Luckily for me, I don't handle the numbers. My colleague does, but we do have a pretty wide range. We serve all of St. Clair County, so East St. Louis to Marissa, we are reaching that far. So we serve a lot of individuals, and we serve a lot of caregivers specifically too.
Have you seen your numbers rise during the past few months, several months now?
Yes and no. Some of our seniors have been coping really well. Some of the isolation is somewhat, unfortunately normalized. But our caregivers have really experienced an uptick in stress because they don't have the access to the respite programs that they may have been utilizing prior. So adult day services or senior companions coming to the home or home care aides. So I would say the rise in our numbers would be those caregivers who are just stressed to the max with continual care in the home.
And so when a caregiver contacts you, and what are some of the issues that you commonly work through?
So some of the issues are, again, like not feeling like they have respite, feeling frustrated and angry, and then feeling guilty for feeling frustrated and angry, a lack of support, feeling isolated from other individuals who don't have the same caregiving duties. It can feel like you live on an island sometimes when you're a caregiver. So we provide a lot of support and just encouragement to and validating kind of where they are and that it's okay to be frustrated. You know, caregivers are human beings too. So that's a lot of what we see with a caregiver.
And so this will go on beyond COVID. How long have you been at this? And
over 5 years, and Jody's been at it longer than I have. Our program's been in existence for quite some time. The addition of me to the program has allowed us to kind of serve more people, and more people are becoming caregivers and serving in a caregiver role in their families. So we are here to support them for that as well.
well, Tanya Kolker, super caregiver, super phone answer. We really appreciate you being here today. Herb, do you have anything?
I just want to thank you for the job that you do over there. It's really heartwarming to know that we have an organization when we get into these senior years to know that there's, not you, that there is such an organization out there, and we really appreciate what you do. Thank you.
Thank you. You've been great.
Thank you.
Thanks, Tanya.
Well, always good information here with Team St. Clair, so we'll put Tanya on Team St. Clair now.
Tanya's on.
She's on Team St. Clair. You heard the numbers today. Some of the ones I want to talk about real briefly from Sam. We had 34 new cases, ranging from, that myth of it only affects the elderly, I think really needs to be addressed. And, we're talking about 1 year and under. And so you really got to start thinking about that. And one thing, Chairman, we've got to really continue to hit home is the mask. And I read some of the comments that our followers put on our page, and I appreciate all of them, all the good ones and all the bad ones, because we try to answer all of them. But, the mask is a big issue. But I've seen some things on there the other night, and if masks are so bad for those that think they are, that you don't want to wear them, if you know a healthcare provider, if you know a paramedic, EMT, you know a doctor, you know a nurse, pick their brain. Pick up the phone and call and ask them, why do you wear a mask when you're in the hospital taking care of patients? Why do you wear a mask when you're on that ambulance responding to somebody's call? Because the reason is they know how serious this is. So for those of you that are sitting there saying, I'm not going to wear a mask, that's your right. But think about your family. Think about the people that you may be around. We're supposed to be practicing social distancing. But at least have courtesy for a fellow man to go out there and put a mask on. We were out today. We wore our mask when we were supposed to.
And science shows if both people are wearing a mask, the chances of passing this disease along is very minimal.
Right.
And so, if you can wear a mask and keep us in phase 4, keep being able to go out and do the things that we like to do in the way that we like to do it. A mask really is a small price to pay. Wash your hands. And in many of the states now where they're seeing a big uptick in COVID, it's with younger people. The ages are now going down, but we still have to remember that it's people that can carry this to those who are immune compromised or elderly and cause issues with mortality that we see. That the deaths in St. Clair County at 139, that is really a terrible
And
number.
the one we had at 40 years old. And the other thing that kind of is the pet peeve with me is when I see people say, well, yeah, but they had underlying health conditions. Well, the death we had the last 24 hours was a 40-year-old person. Yeah, had underlying health conditions, but that could have been something that was minor.
Diabetic,
Diabetic, that's
Yep.
treatable, could have been high blood pressure was treatable. That person probably could have still been with us if they hadn't been affected with the COVID. So just stop and think when you're making all those comments. I'm not asking for everybody to come on here and agree with everything, because if somebody told me that the mask was 100% foolproof, I'd say no, that's not true, because we've heard that. But as you just said, any protection is better than nothing. So as the chairman said, and as we said, you heard Sam say it all along, and if you don't like hearing it from the chairman, if you don't like hearing it from me, how can you not like hearing it from Sam Bierman? After all the days that she's been in here, days and nights, she's telling you, she's hearing it from everybody. Please, wear a mask when you're out. We don't want to go back to phase 3, I can tell you. That would be the last thing I want to do, is to come in here every day. I like these weekly briefings. We'll continue to put those daily stats up. That seems to be going well. We got a lot of good feedback from that, but we don't want to go back to phase 3. If you want to go back to phase 3, I want somebody to say that on the page tonight and put on there, yeah, let's go back to phase 3, and I bet you get hammered by a bunch of people. So wear a mask, practice social distancing, wash your hands. We want to give a shout out to one of our good St. Clair County team members, our buddy Ken. We want you to get well, and so we can get on the telephone and talk a little bit business. So we'll be back next Thursday at 3:30, unless something happens in between, and we hope not. But we'll continue to post those daily numbers, and we appreciate everybody that is part of Team St. Clair, and let's stay in phase 4. Thank you.